Kevin Studey. Dr. Mehmet Oz, professor of surgery at Columbia University, stated in a 2007 magazine article from Current Controversies. His family trusted me with his care, but I knew little about my patient, except that he would die without a mechanical pump to support his failing heart. He had undergone unsuccessful coronary bypass surgery elsewhere before being transferred to our hospital. As we stood in the operating room, ready to make the skin incision, a call from the insurance company was transferred in. The unconscious patient's policy covered heart transplantation, but not the mechanical pump needed to keep him alive while awaiting a donor heart. Should I proceed with life-saving surgery and potentially bankrupt our program, or should I hold off? In any case, I could be sued, either by the patient's estate for denying care, or by the insurance company for compelling them to spend several $100,000 to transplant the saved patient. Dr. Oz came to be one of many victims in his profession of a malpractice lawsuit. Malpractice lawsuits are increasing insurance rates, increasing the number of frivolous lawsuits, and pushing more and more doctors out of the profession every year. Today, I will inform you of the underlying problem of medical malpractice lawsuits in the United States, reasons for the problem, and then I will give you some solutions that may be enforced to fix this problem. Physicians are often sued with little or no merit. Litigation brings about emotional and financial toll to those involved, which is why it should be a last remedy for those in conflict. Hugh Rice Kelly, from General Counsel Texas of Legislation Reform, states that the death of a bull achieved a damage verdict of $8 million, when in other parts of Texas, the death of a human being would be less than $1 million. Litigation brings about lottery-type riches known as jackpot justice to lawyers and their clients. Litigation can be used to bring about broad social policy to make change in America. There is currently no national limit on punitive damages to prevent jackpot justice. As current President George Bush stated in the March 2005 issue of Money magazine, those who have been hurt ought to have their day in court, but we cannot have the legal system be a legal lottery. As more and more doctors bail out of high-risk specialties and high-risk procedures, patients' access to healthcare has been severely threatened. I have informed you of this issue. Now I'll give you some reasons of why it should be changed. The first reasons I like to give you is that medical justice is random. Most patients affected by medical error get nothing, whereas many good doctors may be sued in tens of thousands of dollars. Different juries may make different judgments, even with the same facts. The second point I'd like to make is that medical errors are widespread. Many doctors and nurses are afraid to admit mistakes because they know they will probably lose their jobs. Unreliable justice leaves doctors acquiesced into practice defensive medicine, which means that they will potentially spend billions of dollars a year on unnecessary tests and procedures. According to Philip Howard, in his June 9, 2003 article in Time, some economists estimate that unnecessary tests and procedures ordered by doctors to build a record just in case there is a lawsuit cost more than $100 billion a year, enough to provide health insurance for the 40 million Americans who have no coverage. The next point I'd like to make is that the costs of health insurance are skyrocketing. According to the January 2007 pamphlet entitled An Urgent Call for Special Health Courts by the Common Good, American healthcare now costs more than $6,000 per person, almost twice as much as other countries, but with without the same results. Because of high costs, more than 45 million Americans are left uninsured, with many small businesses unable to ensure coverage. The last point I like to make is that more and more doctors are quitting and retiring. Because of increasing malpractice costs, these doctors see that it is more beneficial simply to retire than to keep paying the malpractice costs, leaving more less experienced young doctors prone to malpractice. I've given you some reasons to support this cause. Now let me give you some solutions. America could set up a health court system, similar to setting up a tax court system and an automobile court system. Judges would be specialized in medical malpractice to make verdicts more fair and accurate. Good doctors and injured plaintiffs would get their results back in 1/3 of a time that it takes regular courts to make a decision. Health courts would set standards of proper care for the system, putting trust in the system and compensation for a set schedule, meaning that everybody that becomes paralyzed from the waist down gets the same amount of money, and everyone that gets their arm chopped off gets the same amount of money, and so on. The next thing that I would like to put out for a solution would be health information systems, which would provide data for everyone in America, for all doctors to have access to. This would make medical records extremely accurate. It would also reduce paperwork and save much time and money. Another big issue would be affordable health insurance for everyone. Uninsured patients today become drains in the current healthcare system, causing existing insurance and tax rates to rise. This could be fixed by setting insurance premiums, by subsidizing insurance premiums for the poor, and making a healthcare limit to everyone else, so that everybody would be able to purchase this healthcare plan at a minimum. Other reasons, or other solutions that may be plausible would be to set an amount limit for a case, to limit lawyers' fees, and to make statistics on doctors who may be prone to malpractice. In 2003, the Texas government set a law called Proposition 12 that enabled the non-economic damages a plaintiff could collect to $250,000. Because of this limit, many hospitals and businesses have come to Texas, realizing that they would be more safe. And thus, the Texas economy has grown exponentially within the last 5 years. Today, I have informed you of the rising malpractice rates, why it has become such a problem to the medical system, and some possible solutions, such as health courts and health information systems. In the time I have given this speech, $1.9 million has been spent on additional medical procedures to prevent such medical scandals. See what you can do to contact your local government and address this issue. Kevin Studey.